Within the patient entrance at Cape Regional Medical Center lies the hospital's Concussion Care Center.
We put them through a bunch of diagnostic tests to determine essentially a baseline for their cognitive and physical capabilities.
The center tries to educate the patients on what's happening within their head.
There's a lot of life changes that happen with people who suffer concussion, a lot of quality of life issues, a lot of emotional issues.
Once the patient starts the process, they start working on the equipment in the center, like the Dynavision, which combines reflexes to light and math skills.
It kind of ties in all the things that we're looking at when we're dealing with concussion. Like I said, anything as simple as simple reaction time to scanning.
Then there's a more physical type of therapy when the patient hops on the bioduct's balance system, causing them to have to keep their weight evenly balanced as the tension tightens and loosens. All of this technology helps to track the patient's progress through the sessions.
We can compare the patient to their baseline to several weeks down the road to, we can compare them again and see how they're improving.
The Concussion Care Center team is made up of both physical and occupational therapists who train for an entire year on how to correctly care for concussions. They trained with an expert neuropsychologist who's worked with concussions in both the NFL and military. Believe it or not, athletes aren't the only ones in need of the care.
But the reality is anybody can suffer a concussion. Just like any other injury that takes time to recover, the brain takes time to recover. It's just that we can't physically see the injury.
Within its first month of being open, the center has already cared for a handful of people. I'm Kimberly Kerr for SNJ Today.